Hello, my name is Kathy Weatherly, and I'm coming to you from Milwaukee, Wisconsin at the Solaris headquarters. With me today is Linda Rorty. Thanks for driving up from Chicago for us. Linda is a physical therapist. She's been treating in the area of physical therapy for 26 years. She's been specializing in lymphedema treatment for 15 years. And on top of all of that, she has been an instructor for the Close Lymphedema Training Program. Quite an experience, broad experience range that you have. Thank you for coming up here. We want to talk about individualized treatment and how to create an individualized treatment program. Recently, you'll move to the next slide. Solaris has gone from Solaris Freedom to Live, and many people in the industry know it, to being part of a new company. And there are our big, beautiful trucks coming in that announce that we have joined Lohmann and Rauscher. Lohmann and Rauscher is a medical product manufacturer. And with them, combined with Solaris, we are now able to offer you a real 24/7 solution for lymphedema, edema, wound care. This has been a long-term want of mine, is to be able to be a resource that we not only carry one product, but we carry multiple products for the therapists. So, Linda, why do we need an individualized treatment program?
First, thank you, Solaris and Lohmann and Rauscher, for asking me to come to the program and event and talk to today. When Kathy asked me to speak of this topic, it was easy for me because this is what I do every day. When I did my certification, I was exposed to the Lohmann and Rauscher product line. In the classroom, we perfected how to bandage each other, normal limbs, how to bandage them from foot to knee, foot to groin, arm. So we learned how to use the tools for compression bandaging. But when I got into the clinic setting, what I realized is that there's no real definition for lymphedema. Patients that we see, and if there are patients out there, I'm speaking to you also, the patients that we see come in all shapes and sizes. I can't have one protocol that is going to fit for every patient. So you address each patient individually. And so as I started my journey of treating patients with lymphedema, I had to look farther than what I was exposed to in the classroom. And if you look, the Lohmann and Rauscher product line for compression bandaging, they have a wide variety and range of products that allow me to do what I need to do to give individualized treatment. Start with the stockinette. The stockinette comes in a variety of sizes. There are three main types of stockinette that I can use on a limb to be able to address each person in their needs. The bandages, when we look at the Rosedal K bandage itself, the Rosedal isn't just a short stretch bandage, but it also comes in a stronger or a stiffer bandage if needed. So there are many products out there from the bandaging selection that Lohmann and Rauscher has, and what that does is that allows me to give the excellent care to my patients.
In your practice, how do you start this process of designing an individualized treatment program?
The treatment starts with the evaluation. Each patient is evaluated, and I take each patient into consideration. Start with listening to each patient is important because the lymphedema affects them differently. As a physical therapist, I need to look at range of motion, strength, mobility, how do they do with walking, and what problems are they having. Can they do their day-to-day jobs? So from there, after I take my initial assessment, I need to do that lymphedema assessment. And first thing I look at is I look at the skin quality. What is the skin like? When you're looking at a patient with lymphedema, many times with the lower extremity, the skin is compromised. It may be dry, it might have hyperkeratosis, just a thickening of skin on there, but the skin may be compromised where there's blistering or even drainage happening from the limbs. And that's a true problem. And as therapists ask me that question, I always guide them to look at different wound care products. And what I had come to realize is Lohmann and Rauscher, there are a vast array of compression bandaging. They have just as many wound care products on the market to allow me to do what I need to do. They have products from calcium alginates that are highly absorbing to foam pads that I can use in the clinic just to cover up a small skin area so that I can then turn to go into compression bandaging. I need to address the skin first. One of the products that I'm going to talk about briefly here is Debrisoft. Debrisoft is a new product to the United States, and we were able to use the product in our clinic setting. If you, a patient or the therapist, have come across patients that have the dry skin, excessively dry skin on the limbs, or hyperkeratosis, or even a very superficial wound on their limb, Debrisoft is a product that we were able to try. And what it is, it comes in individually packed containers. Each product is individually wrapped, so it's sterile. And the fibers are uneven, and it allows me to do a soft debridement on the limb. This is a foam pad, and you do hydrate the pad before you use it. And it takes 3 to 4 minutes on that dry, dehydrated skin, hyperkeratotic skin, to allow a soft debridement. And what it does is it cleans the tissues. I want that dry skin to come off. I need to be able to have healthy skin, again, to progress my patient's treatment. One of the pluses with this product, I've had our rehab staff use it up in our rehab department. We've used it in our acute care side, and we've used it in our outpatient side. We'll be able to use a product in our wound care division, but also home health. So it's a great tool, great product that doesn't require a lot, just some hydration and the Debrisoft itself. So this is new on the product line in the United States. It has been used in Europe for quite a long time now. So after I address the skin issues, I then have to look at the shape of the limb. Each patient's shape is different. And again, go back to there is no standard for lymphedema. Every patient looks differently, an arm, a leg, head and neck, and I need to address that. So one of the challenges I realized when we were in the classroom, when I was doing my initial training, we had Salona, which is the padding, the cotton padding, and we had Rosidol Soft, which is a very thin padding. And that works great for somebody with mild edema or lymphedema problems. But when you look at a patient that has more complex needs, I need to look at other foam products. Lohmann and Rauscher has a variety of foam products that we're able to use. For this patient here, what I used is I used a Comprex sheet, and I cut the Comprex sheet and crafted it so that I was successful with my bandaging system. A key to treating a patient with lymphedema is to make sure that they have a good bandage on in between our treatment sessions. So this is a very challenging limb to treat, and we were able to do this successfully with the Comprex pad. So looking at other products of foam that you might not be aware of, one is Comprex 2. Some therapists in the clinic will call that spaghetti foam. It's a channeled foam. And so it comes in a sheet, and as a therapist, I can cut this and shape this to the size of the limb that I need. The channeling gives a little bit of uneven texture in there, so it helps with any thickening on the tissues, but again, I can conform it to the limb. When I look at the Comprex pads themselves or products, Comprex comes in a sheet, it comes in kidney shapes, and it comes in a roll. Again, I can take this foam product from Lohmann and Rauscher and craft it to whatever I need to meet the patient's needs to have a successful bandage on the limb. So after I look at the shape and decide the foam I'm going to use, the other thing I look at is the fibrosis. The easiest way for me to explain fibrosis for the non-medical listening to this webinar, When you have lymphedema and you have protein-rich fluid, it starts to thicken the tissue. So we know what normal skin in an arm or a leg feels like, but what happens when there's lymphedema? It can thicken the tissue. And so with that, it almost feels like clay, like there's thickening happening. And I need to address that with my bandage. My manual lymphatic drainage is not enough to soften the tissues. So one of the products that we use is a swell spot. Solaris evolved swell spots over 15 years ago. Since I've been doing this, there are now more than 22 different swell spot shapes, sizes, to choose from. And the piece is too, you can have a custom swell spot made. And it is what it says. It's to treat swelling, treat an area, and it's a spot, it's a shape. So if I feel an area that's thickened, I can choose the appropriate swell spot shape and bandage on top of that. And what that's going to do, it's going to soften the tissue. The other option for fibrosis or the thickening of the tissues would be a Caresia. So that's the blue product over here. And I have a calf and a thigh unit on the patient. And inside the Caresia, there is uneven chip foam pieces in there. And with a Caresia, it encircles the limb. So I'm able to get circumferential uneven chip foam, and so it's softening the entire limb. The Caresia itself is made as a liner, so that is something that I do bandage on top of. So both of these products give me the ability to soften the tissue. Again, I'm going to address the skin, I'm going to address the shape of the limb, I'm going to soften the tissues.
So, Linda, what happens when a patient, for some reason, cannot do your traditional bandaging?
As I say, we need to think outside the box. For the therapists out there that have gone through the lymphedema certification, you have your foundation. You know how to bandage a limb. But I can tell you there's a lot of patients that I need to think outside of the box to have a successful treatment for this patient. Not everyone can do what I was taught in the classroom, the traditional CDT treatment. So one of the products, Solaris product line, is the Ready Wrap products. An example is we had a lady that couldn't go to work because she was required to wear a specific jacket for her job, her duties. And so her jacket, we kept going up in sizes, but it wouldn't fit over our bandage system. So what we did to reduce her arm, she stayed in that intensive phase with me in therapy. But what we did is we used a Ready Wrap arm product, and it's Velcro, and it allows the patient and allows us as a therapist to take that on and off. And as the limb reduces, we're able to take that to a smaller size. And then when you look at the leg picture, we have a foot, calf, knee, and thigh Ready Wrap product on the patient. Again, there are times I need to think outside the box. It's not what I was taught in the classroom, but I need to be successful to treat the patients. And I think over the last 15 years, really the evolution of our lymphedema treatment is the fact that we have products that we can use. And as therapists, realizing that, you know, again, go back to your Lohmann and Rauscher and the combination with Solaris, we now have a complete product line to use 24/7 for our patients. So Ready Wrap is one of the products. In our wound care division, we will use the Ready Wrap calf with our patients that are still receiving wound care treatment. As I say, clinically, I have realized many times I get the swelling down before the wounds have healed. So once the swelling has reduced, we're able to put the patient in a Ready Wrap calf and allow the patient to go back and forth to the wound care department to have their wound dressings changed and not have to do the layers of our lymphedema bandaging, but be able to maintain that with our Ready Wrap calf. The other product is a Caresia Liner that I talked about earlier. The Caresia Liner, using that in your treatment or in your intensive phase, what it does is allows the patient to be able to self-bandage faster. Kathy had asked me this question a couple weeks ago, how many of my patients self-bandage? Initially, if I need to have a patient self-bandaging early in their treatment sessions, I'm going to get them into a Caresia Liner because it takes all of the foam products away, but it allows me to have the patient slide this liner on. The foam is in each of the channels here inside of the Caresia, and they bandage on top of that. The plus with the Caresia, it comes in a small, medium, large, and I'm able to fit the majority of my patients into some type of Caresia. The arm works great for those patients that need to take their arm bandage off but turn around and rebandage. So it's a great tool to use in the intensive phase. But then again, I can turn around and use this in the self-management phase that the patient can then bandage on top of.
Thanks, Linda. So the patient is done with the active phase of therapy. What happens next?
Well, that's a great question. I might be done in the intensive or active phase while they're with me, but part of my treatment before I finish is figuring out what is the patient going to do for self-management. What is the patient going to do for that maintenance phase? If the patient does nothing, the lymphedema will return. So a big piece or key to our treatment is finding the right tools for our patients so that they can be able to manage this lymphedema, be it an arm, a leg, head and neck, genital, trunk, wherever the swelling is. So one of the things I learned 15 years ago, gold standard of daytime compression was flat knit compression for our lymphedema patients. Flat knit speaks of the fabrication or how the product is woven and how the stocking or garment is made. One of the things that came out a few years back is Solaris designed a flat knit product. So I have the stiffness of a flat knit construction, but they made it to a pre-sized product. So I'm able to get the durability of the flat knit. But one of the pieces, having something that's pre-made, it has cut down the cost for many of my patients to be able to get into a flat knit product if they fit into the standard sizing. And so with the Solaris product line, they evolved out Exo Strong, and Strong being the flat knit product. So it's a great tool for me to use in the daytime for my patients. And again, once a patient has finished the intensive phase, bandaging is nighttime. Garments are daytime or their waking hours. So the Exo Strong is a great tool or a product to use during the day. But then I look at the Tribute product for nighttime. I have said this for years, the Tribute product sells itself. It's a great product. It's custom. So if I need fingertips to elbow, if I need foot to knee, I can have the product made to what the patient needs specifically. Yes, it is custom, so it's not going to fit everyone. It's going to fit my patient. With the Tribute line, it evolved out the way we were taught with bandaging and the way our garments work. We have more pressure at the ankle or at the wrist distally and less pressure proximally. There's more foam at the ankle and the wrist, less foam density at the thigh or at the shoulder. So with this, it's different than the Caresia line because you don't bandage on top of this. The Tribute line, when my patients have seen the Tribute line and go into the Tribute line, this improves somebody's quality of life. It's a product that can be donned or slid onto the limb very easily. If needed, we can choose to have zippers in the product. We can use Velcro closures, pull-up loops. We can have non-skid pad on the feet. So there are many ways to use the Tribute line to make it so it is custom to each person's need. If there's more pressure that's needed, what we can do is use an outer jacket on top of this to add 10 more millimeters of mercury pressure onto the limb. There's uneven foam in there, so it is going to continue to manage the limb and soften the tissues while the patient sleeps. One of the pluses with this product is it allows a patient to be able to bend, sleep with their arm bent, be in positions that we would normally be in while we're sleeping and not confine the limb to a straight position. So it is very comfortable for the patient.
Thank you, Linda.